This is the In-Situ Hammocksling. With an in-situ sling and a hammock sling, toileting then becomes an issue. You may have to use the Go sling or the My Sling looped high back sling to toilet. But in this case, this sling's folded in half, making sure that the sling will be running down the centre of the patient's or the client's spine, leaving a gap so that you can roll the sling into it. Now the sling is 3/4 on, and it's a lot easier to pull through, not having the need to roll the client fully onto their left-hand side. Short loop at the head, long loop at the legs gets you a good sitting position. As you can see, the looped hammock in-situ sling gives plenty of support. There's extra padding just underneath the limbs so that it doesn't mark the back of the patient's skin, and it's easy to use to get into a sitting position on the chair. Again, with an in-situ sling, you cannot have an aperture, as there would be a seam around the aperture that would not be good if left underneath the patient.